Hi everyone, my name is Miriam Smith, Doctor of Nursing Practice. In today's episode, we will be addressing therapeutic communication in nursing. What is that? This is a communication whereby an establishment of relationship, of connectiveness is being made, in that the patient will be able to feel comfortable expressing themselves. The nurse will be able to communicate freely with the patient in developing a safety care module. By that I mean that the establishment of this communication will aid in the recovery, will enhance the recovery of this patient. Therapeutic, that's what we want in delivery of high quality care. Now, the first technique that I will use in therapeutic communication is active listening. What do I mean by that? Listening to the patient. Just be there for the patient as the patient speaks without any interruption. Let the patient process or communicate, explain, express themselves. When they're completed, then you can continue. So we should be actively listening. Secondly, I want you to think of another technique, which is silence. Silence, yes. This patient might just have received some information on the diagnosis, which is not good, maybe life-threatening. And so the patient might just be really, really sad. Now it's the responsibility of the nurse not to probe and probe and probe at this time, just to be there for the patient, just to be quiet. And that concern does a lot for that patient. And later on, after that processing period, conversation can be ensued. Thirdly, and the last for today, is asking the patient open-ended questions so that you can get the information from the patient that is needed for the care, the plan of care for that patient. And so it's so important not to ask the patient just, you don't use a why like that. It's important. Ask the patient how are you doing today? This will allow the patient to explore, to talk more about their feelings or the pain or whatever they might be experiencing. They will talk about it freely. Rather than if you should just say, are you sad? And the patient might just say yes or no. We don't want any question to be phrased in that way that the patient might just answer yes or no. So my young nurses, my new nurses, and also my senior nurses, it's important as we care for our patient to listen, to be silent at times, and to ask open-ended questions. And that will help us to deliver the high quality care that all patients deserve. In closing, this is Dr. Miriam Smith with Empowering New Nurses podcast. What is in your hand? Follow me on Instagram, Facebook, Telegram, and at PodcastMare for more information on therapeutic communication so our patients will receive high quality care. Thank you.